Hi, everyone. I'm here with one of our sponsors, representatives, Jason Kaiser of Kettenbach. I wanted to talk to him about Kettenbach products and Kettenbach as a company because I personally wasn't familiar with the company until I met you guys at one of the meetings I went to. I think it was called Happy Dentist. Let's give that doctor a
Oh yeah, with Dr. Gupta,
yeah, Dr. Gupta.
Ankur Gupta in Chicago, right? Last summer.
Yes, yes. I
Excellent.
yes, I was there, and we have talked a few times since then. But yeah, that's where I met one of your representatives, and I was shocked that I had never heard of Kittenbach, to be honest with you.
Sure.
And I'm actually more surprised after I started using your products that why haven't I heard of your company? So I wanted to kind of use this video to introduce you and your company and your products to my members. So take a minute or so, Jason. Tell me about yourself and when did you start with the company and what do you do for them?
Sure. Well, it's an honor to be with you. I was checking out dentistry in general, the Facebook group, and congratulations, Dr. D, on getting your membership up. Looks like you're right around 6,000 members,
Right.
and that's no small feat. And it looks like they're all dentists. So I'd be lying to you if I wasn't a little nervous right now to connect with everybody, but I'll try to do a good job for you here to kind of get you updated on Kettenbach and kind of the story.
Mhm.
But to your question about myself, I grew up in dentistry. Fortunate to be born the son of a dental lab owner. Okay, Columbus, Ohio. My dad owns a fixed Crown and Bridge lab, and basically after high school, dad said, you want to give this a shot with me here and work at the lab, and I took him up on it, so I was at the lab for about 10 years, working in multiple different departments in Columbus, Ohio. And then I got the itch. I'm an extrovert. I liked to talk to people, and I saw these sales reps coming in, so I ended up leaving the lab and joining a couple dental companies to be a sales representative. I've worked in the implant space and the laboratory space, and now with Kettenbach for 7 years now. And I've initially started as just the Ohio rep. I would cover most of Ohio, Western Pennsylvania, West Virginia as a direct sales rep, a manufacturer's rep that only sells direct. And then at some point, I got the opportunity to become kind of a player coach with our company. That's how we do our management here. We have our own territories. We do the job, but we also kind of become mentors to
Mhm.
younger reps with the company, and try to bring them along. So currently, I'm a territory manager here in Ohio, Western Pennsylvania, West Virginia, regional manager to the Midwest. And because of my dental lab background, I kind of created a position for myself as the national dental lab manager for Kettenbach. I really wanted to emphasize the importance of our relationship with dental labs as well as dentists. I truly believe that our product line is in many ways the bridge between the two entities, and we can make a big difference on both sides of the fence if we're being honest, in terms of quality and consistency and inspiring results, because that's what we're after, right? For our patients at the end of the day. So that's a little background on me. And yeah, so
Great.
I'm an open
Um,
book.
I started using some of your products and I was surprised at the high quality of it. And one of the products that you guys have that I really like is this and I don't know if I'm pronouncing it right or not, Salginate.
Uh-huh.
It's the basically a more economical PVS that you guys promote as an alginate substitute.
Right.
Correct? Tell me a little about that.
Yeah. And I understand you're friends with Dr. Paul Goodman.
Mhm. Yes.
Okay. So he's like, we're so grateful for him, one of our biggest cheerleaders. And the way he approaches it is by challenging dentists to think like, hey, why are you still using alginate in the practice? Now, trust me, I've had an alginate impression. I know how powerful they can be. They can be amazing impressions. I'm not disregarding the quality there. but there is a soft cost associated with it. You know, I mean, paying your assistant to go pour up a model that at the end of the day has got bubbles and it's not the stone water mix that you're looking for. And, you know, there's no base to it. You know, it's just like those kind of, how many times does that have to happen before you're like, what else is there? So alginate alternative is really the category that Silginate or Silginate strawberry, most popular in our company, is coming into, right? It mimics alginate. It does everything that you need an alginate to do. It just happens to be a medium body PVS that is stable immediately. There's no degassing process. So if you're currently using something like this and you got to wait 30 minutes, not the case with ours. You can go straight to pour up, or, I mean, hey, you got the advantage of bag it, tag it, and send it to the lab. Let them pour it up. Matter of fact, now they're accountable because they poured the model, right? So they can't, you know, say, hey, the model you sent us, you know, wasn't working, right? And the case falls through. So yeah, medium body PVS coming in the gun, coming in the jumbo. It's a minute 30 intraoral set time. Okay. So, you know, it's quicker than, you know, final crown and bridge material, but a little longer than like a quick set bite reg. But the details are phenomenal. You know, the way it can get into the interproximal areas, pick up anatomy detail. I mean, if you're, you know, 90%, I think, of what people use it for is a preliminary to a temporary matrix. You know, and then it's got some other uses like what we say, opposing arches, right? So your working side is going to have the good stuff. Your opposing is a Silginate. You know, more cost effective, right? Study models. Okay. You know, even if you're getting like a custom tray made for a denture or maybe a diagnostic wax up or something like that, you could use Silginate for that. Anything really supragingival, I think that's what you got to think about. Supragingival impression, go Silginate. I will put a disclaimer out there, though. Be careful with brackets. Whereas alginates can rip through brackets and no problem, doesn't hurt the braces. If you use Silginate around brackets, it could lock in. Matter of fact, it probably will. So avoid that. But everything else, you know, in terms of what you'd use alginates for, really nice material.
And this can be poured multiple times, right?
Yeah. Yeah. So about 5 times before it starts getting torn up, you know, but yeah, that's another advantage. Absolutely. Multiple pores, dimensionally stable, and pretty economic. Pretty economic. Yeah. So like, you know, we sell direct, right? So people buy the 24 pack a lot of the Silginate strawberry in the gun because of the way it's used in a practice, pretty high volume product. Then of course you can go to the jumbo machine. Let me ask you, I don't know a ton about your practice. You practice out in Aurora, Illinois?
Right. I'm in Aurora, Illinois, and I'm famous for saying I haven't used an impression material in 8 years, but I
Oh,
but I do use it.
well, that's
I'm
fine.
just
We'll get to the resin side of our business later then, and we
right.
maybe might be able to bend your ear there. But yeah, so even though for people who are scanning, right? Yeah, you know, if you're scanning, you still need to make a preliminary for your temporary matrix. And
Right.
you know, the scanner's not doing that now, unless you're going final to like a CAD cam, you know. But if you're scanning and sending, let's make a prelim at a Silginate, and I think you'll love the results.
Yeah, I mean, I have to be honest that there are still people who are comfortable with taking impressions. That's why my whole approach with Kettenbach was, and because I feel like the demand is stabilized or goes down, the prices can go up. So someone like Kettenbach who can save people some money on their impression material comes in handy. Now I wanted to ask you,
Wait,
like,
hold on. I think
go ahead.
I gotta dive into this. So you
Uh-huh.
just said as the demand goes down, you could see the prices going up.
Right. It has
Now
gone.
that's interesting because that would be in a way some might not feel that's not very nice of the companies to do, and that's a shame. But no, I mean, the way we approach the market with our direct nature, we had a very minimal price increase into 2023, really related around just cost of doing business. As we know, it's hard in America right now,
Right.
but not like these significant increases like maybe what you're speaking to. That's a shame. No, we're not in that way.
Yeah. Have you noticed that trend from your competitors that
Well,
they're
the one thing that I will say that we've had a heck of a start to the year.
Right.
And some new customers coming on board, people, really looking and leaning into our value proposition.
Right.
It's awesome. So we're excited. We're really helping out a lot of people, and I think they're digging the value that we
Yeah,
bring to the table.
and I hear this from everyone that like the price of impression material is going up. So what are our choices? And I like to hear that a company like Kettenbach, who sells directly, cuts the middleman and can decide how we're going to price something. But I like that direct sales to dentist a lot actually model.
Good.
What I wanted to ask you was, or actually comment, is that even for someone like me who scans a lot, and I have a in-house mill that I mill my own temporaries. Look, I have to have impression material on all the time.
Yeah.
One of them is for bleaching trays. I mean, we still can't really
Okay.
do
Yeah.
um,
Bleach trays,
you know,
sport guards, you know, lots of different things. So
right,
that's
right.
great. Yeah, Silginate would be a product I'd really recommend for an office like yourself. Kind of a utility player
Yeah.
that could do different things.
Yeah, and I also, even though I'm digital, I still make my dentures the old-fashioned way. So I do
Okay.
use a lot of PVS for custom trays that I make for my denture patients.
Yeah,
So
let's dive into that. Do you generally do like a massage technique, or you do stops, or do you kind of border mold in and out, reline?
yeah, I do everything the way I was taught in dental school 30 years ago.
Oh, I got you.
Follow
Green
every
stick.
yeah, I follow all the recommendations that were there back then. I if I have an existing denture, it's my favorite because I use that as my custom tray.
Oh,
And
there you go. Sure.
you
And
know
you reline that with some nice wash material.
exactly, and
The
that
Panasil. You got to
yep,
try we have the gray goodness. So if I could segue a little bit,
sure,
Panasil is our final crown and bridge material PVS, right? So we're going to handle lots of different clinical indications. So as you mentioned, relining a hard palate denture. So we have three viscosities of light body. We call it Panasil initial contact, and then we have extra light, light, and regular. And a lot of people like the regular light for that particular indication. A little thicker wash material, very hydrophilic, but underneath that compression of a hard palate denture, it holds its own, and it kind of
right,
flows nicely, but doesn't just squirt out the back of the impression, So
right.
real nice material for that. I hope you try it sometime.
Yeah, I do actually. I have taken some pictures of it for the group as I used it. Yeah, one of your reps dropped off some samples for me, and
Oh, good.
that's why I'm saying I'm so pleasantly surprised at the quality of the material. And I
Yeah.
wanted to ask you about that. I know this stuff is made in Germany, and
Yeah.
uh, and do you guys have anything here in the US that you do, or is it everything is based in Germany?
Yeah. Good question. So around 1955, Kettenbach invented silicone impression,
Mhm.
called it Lastic 55. It was the first time they switched over from gypsum material to silicone. And then until about 1975, I think, that particular owner had the company. And then the current owner, Jens Kuhn, and his family own the company Kettenbach and have continued to develop the product line in the dental and medical space. Everything is manufactured in Germany, Eschenberg, Germany. And, it's a family run business. I was listening, I, of course, meet Jens from time to time at some of the bigger dental meetings when he comes to the States, but I listen to his podcast interviews. He's been on with like Howard Ferran and um, a couple others. And one thing you mentioned about quality. Well, as a company in the dental space that's not beholden to stockholders,
Mhm.
on traded on the public floor, they have the ability to reinvest the money into things like quality control and research and development. And Jens made a quote: 20% of that overall money is reinvested into those two categories. And he said there was 9 PhDs on Kettenbach's staff. So if you're employing 9 PhDs in Germany, you're doing some science, right? We're a chemical company, and that's what's so cool. So yeah, so I really, I've been with Kettenbach 7 years, right? And the reason that, I'm really still going and growing and really busy is that just there's so many people that I still have to talk to about this product. Just like you said, like I barely knew you guys, and now I have you, and oh my gosh, where have you been? So we got a lot of work to do to get this out there, but each one of our products kind of has this special blend of that quality plus these kind of superpowers in the product. Just each one of them's got this unique thing that others don't. So yeah, so that's as people know, of course, there's a correlation to German products. The quality goes hand in hand, these types of cars, and the people you've experienced with German products, and we're right there with them. So the other thing I just want to mention too, we touched on, is the direct nature of the company. When Jens Kuhn started business in the US, I think we're coming up on about, is it 15 years or so, in the US. He very well could have gone to the major dealers and said, okay, here's Kettenbach's product line, slide it in where you see fit. But he went direct, and he started with $0, right? And at some point, Dan Perilli, who is our current general manager, longtime veteran in the industry, really knows it well. He's been leading our company for many years now, and really, I'm a big believer in him and his guidance and knowledge of the industry. And yeah, we've been able to maintain direct nature, and we're the manufacturer, so that's our approach to the market. And it's not easy, because there's some giants in this industry, as you know.
Yes.
But we're chugging along really well.
And that's what I like to see. I want to, one of the purposes that these kind of type of interviews serve, I like people to listen to this like a podcast, basically.
Yeah,
Driving to
I love
work.
podcasts.
You don't need to look at us, but you can just listen to it and
Yeah.
and drive. But one of the purposes this will serve is the fact that we like, as Americans, to support companies that are loyal to us as dentists.
Okay.
I want to see someone who has good products, but also realizes the challenges a dentist faces. For example, if I see an impression making company looks at the opportunity to raise prices when our fees and our income has reduced because of the cutback by insurance companies, I want to see who's my partner in these during the hard times.
Yes.
So when I'm not dealing with the hard times and we're back out of it, I will stay loyal to them. So my purpose is to basically let people know of Kettenbach. And I have to tell you, when I brought Kettenbach up as a sponsor, I had many people who had good things to say about it. As a matter of fact, I haven't had one negative comment about Kettenbach. The only issue is a lot of us haven't heard of Kettenbach, and
Okay.
that's what we're trying to change.
Perfect. Well, allow me then to very quickly give you a very high level introduction to each one of the products that we manufacture.
Perfect.
Okay. All right. So let's start first off with Futar. World-renowned product. When you say Futar, does that correlate at all in your head? Have you heard of Futar?
I mean, I have it in the office right now.
Okay. Well,
but before, I'm going to pretend that this is before I got introduced. So,
many people who may listen to this, the 6,000 members in your group, will recognize the name. And the reason is because it's a bite registration that many occlusion education facilities, Dawson, Pankey, LVI, people who are very, very deep into occlusion theory will know Futar because of one, just the really awesome makeup of the material, just the way it flows, the creamy consistency, how it stays on a bead on the occlusal table, the trimability, it doesn't crumble, it stacks well. And of course, it's dead on accurate, right? The other thing is with Futar, there's multiple different versions. So Futar, which is teal in color, Futar D, and this is the one that like a lot of TMJ and TMD doctors love because it's really hard. It's almost like acrylic. You actually have to trim this, or we recommend you trim this with an acrylic burr versus a downward pressure of a scalpel, because it's just like you put that much pressure trying to trim the flash, it sometimes snaps it because it's just really rigid, right? So specialty bite, but very hard. And then we have a Futar Clear, which is mainly, a little softer, not meant for posterior bites, but anterior tag bites or matrixing through, light curing through, visually check your bite. And then we just launched a new product, which I have to promote, Futar Easy. Okay, so Futar Easy dispenses like very much like a mousse-like consistency, right? Airy, fluffy, comes out just so easy. I'm really excited about this product, not only for like a bite reg, but for those offices out there who use like a Blue Bite or a house brand bite reg for their preliminary matrices because it sets real quick. Now we got a product that can actually do that as well as be your bite reg. So the next product that I would touch on is Panasil. We talked a little bit about that. It's our final crown and bridge.
I'm gonna interrupt you is that I like that clear stuff also.
Oh, yeah.
As if somebody's has a tooth that I want to basically duplicate, I can take a quick matrix and then fill it up with a
Sure.
some kind of a temporary composite and then light through it. The
That's
clear
right.
has, you can use it for a lot of different things. So it's one
People
of my
are
favorite products.
injection molding, popping a
Right.
hole through it, getting their composite in. Um, multiple different uses. I even talk about this anterior tag bite, right? Where, some of these dentists out there who face these really funky bites. And sometimes it's better for you to actually get in front of the patient, manually grab their mandible, put a strip of the clear on the anterior mandible, and then visually, put that bite where you want it. Let it set, pull, and then get the harder registration out and put it in the posterior and then realign them back into that initial spot that you tagged with the clear.
Right.
Yeah. So sometimes with those kind of bites with the colored registration material, you can't see where they end up, a little too much. So anyways, yeah, the clear is great. Visually inspect your matrix.
Right.
Now Panasil, I don't want to dive too much into the weeds with it, but if you're using an Aquasil, an Imprint from 3M, Kerr, all these different brands, we know them all, right? You got to ask yourself how they doing, right? And I know you get to become a creature of habit, but the superpower of Panasil is that we're very hydrophilic. So really dealing with a lot of moisture issues. We have a less than 10-degree contact wetting angle. The surfactant is built into the light body, so it's kind of this patented technology that we're really proud of. And so basically, when you're in blood, when you're in moisture, when you got a deep subgingival prep, this is material that can really help you and nail it the first time. That's the goal, right? And get your lab, something they're happy with, quality in, quality out. The next thing about Panasil is just the variety, whether you want, a jumbo cartridge or a 50 mil, or if you want putty, or if you want medium body, different types of heavy bodies, different types of light bodies, lab putty. We got regular putty. So for people out there making analog impressions, you got to look at Panasil. It's about, okay, now let's touch on this. This is the big price point thing that I need to talk to you about. So we're never going to be the cheapest company out there, right? Never going to be like the bottom line, right? But if you compare our pricing to the premium players that sell through the big dealers, now we're talking 30 to 50% less.
Right.
And I can say that pretty confidently, right? But if you want to compare us to like an economy brand or the middle of the pack, now the savings proposition isn't as strong, but that's where you got to come in and say, well, does a Panasil PVS significantly kick the butt of the medium grade PVS I currently buy? And we're in the same price zone. So that's where I challenge those out there to kind of give us a look. Really hydrophilic material, lots of variety to sink you into. We
Yeah,
talked about.
I
Oh, go
wanted
ahead,
to kind of interject here a little bit as well.
please.
And in my group, I'm famous for saying that I don't bring the cheapest. I
Good.
want to bring the best
Right.
at a favorable pricing for my group. Can you
Yeah.
find cheaper material, cheaper products, cheaper
Always.
services? Always. You can
Always.
buy non-FDA approved impression material on eBay for a
Right.
few dollars.
Sure.
I'm not about that, and I'm not judging people who want to do that. But I don't want to redo things. I don't
Right.
want to
Time.
get.
Time.
No, it's especially in an impression material.
Yeah.
If you are dealing with um, kind of distortion, now you're chasing that rabbit for 4 months and see what went wrong with this implant case, what went wrong with this crown case. So I wanted
Yeah.
hear about the quality, and then sure, if you can save me some money, all the better. But quality is number one, at least for me, and I know a lot of my friends and colleagues.
Good. Good to hear. And we're a good match if you feel that
Yeah.
way. We talked about Silginate. Um, you know, that if you're interested in this, we sell a 24 pack and then a 6-pack of the gun form. The 6-pack is very inexpensive, and it could really be a game changer to your practice if you're still taking alginate impressions.
Mm-hmm.
Matter of fact, we talked about Panasil, we talked about Futar, we talked about Silginate. I want to throw out just a very simple deal for your members to consider. For $99, I like to say $99 because it's not a lot of money, but it's skin in the game to kind of put you accountable to not just get this stuff and put it on the shelf and forget about it, right? So what about this? What if we got you pick 3 items, right? Pick 3 items for $99, right? Pick a Panasil heavy body, a Panasil light body, and a Futar bite registration. Or pick a Panasil heavy light or medium light and the Silginate 6-pack for $99, right? So pick 3, figure it out. If you want to add on another 33 for all 4, go ahead. We'd love it. We'd love you for trying us out. Everything's going to come with a risk-free trial. If you don't love it, even if you used it all up and you're just like, I'm never ordering this again, we'll credit you. But I don't think you will. I really don't. I think you'll be really impressed with the material. So Silginate, we talked about that. Real high level overview. Identium. Identium is a vinyl siloxane ether. It's a mouthful, right?
Hold on. I'm going to clear this because I don't want people to get, because in the beginning I got confused myself. So we
Okay.
had the Silginate that was an alginate replacement. It's a
Sure.
medium body PVS.
Right.
And then the next one you mentioned was, say that again.
Well, there's Futar bite registration as well.
Futar. Yeah, we know
Yep.
that Futar. And then
we
what
have
was
different types of Futars within that family, right? Oh, you want a clear? No problem. You want the regular posterior bite? Sure, we got that. You want the specialty hard bite?
Right.
Want the blue moose kind of consistency? We have different varieties for all those who have different flavors.
And then your impression material is called
Panasil.
Panasil. And this Panasil, this is a common question that I got from my members when I introduced Kettenbach.
Okay.
And that was, can I use it in my Impergum gun machine?
Good question. I love this one. All right. The Pentamix 2. Pentamix 2, which is an older one. It'll say it on the side. It's the kind of longer, skinnier. You'll know it. It's about 10 years old and it's been busted to crap, for a while now, right? I've seen many of them as I go around. Those work with our products, no problem. However, when they designed their new machine, the Pentamix 3 and the Pentamix Lite, they closed their system. It's what dental companies like to do, closing the loop. So there's a little computer sensor chip on it that doesn't play nice with others. And when you put our Panasil jumbo cartridge in a Pentamix 3 or a Pentamix Lite, it's kind of like rolling the dice in Las Vegas a little bit. Okay. Sometimes it works, sometimes it doesn't. It's very finicky. Dentistry is about consistency. So it's not going to work. I don't love if my client has one of those machines, it's like I'm leaving my like loaner to like, hey, use this machine. I don't want you to, be chair side and this thing's not coming out. So we support the Rentfort Simpris auto mix machine. This is open architecture. Dentsply Aquasil sells the same one. I think Heraeus Calzer. Many of the other companies use this open architecture device made by Rentfort that allows us to dispense the material in the jumbo consistently. 3M's the one that, and 3M and DMG have unique machines to their product line. However, having said that, if you buy $1,200 worth of material, we'll get you a free machine. That's our investment to you to help you use the product that we sell and are proud of. So if your machine is busted, if you want a machine that can accept others, maybe not even Kettenbachs, but others, we'll get you the right machine that allows you to do that. But I think if you try our products, that you get $1,200 worth of, anything, mixing tips, resins, whatever, just get it up over 1,200. We'll get you a free auto mix machine.
So basically what you're telling me, these auto mix machines are 3 variation. The 3M makes their own.
Yes.
Then you have the new Impergum, which they close the system so nobody else can use it.
Well, I mean, the newer machines just have little sensors on them that 3M
Right.
products match, and it allows it to, so you got it pretty much right.
Oh,
Not just for Impergum, but also for their other products.
For their other products. Gotcha.
Yeah.
And then there is this third kind that most of the companies use. So if somebody gets that machine from you guys, they can use other impression material with it as well, so including Kettenbach.
Correct.
Okay, great.
Yep. So that kind of speaks to what you were talking to earlier. We want to try to make this easier on people, not lock them in, give them flexibility, and let the chips fall where they may on the best value out there on the table.
And the guns that they have, if somebody not using these automix, the guns they have, it is 1-to-1.
Yeah. So our Panasil, Silginate, Futar, all of them are going to fit in that standard 1-to-1 gun.
Okay.
So there's no issues on the gun.
Okay, great.
All right, cool. So if I could continue with a quick overview, because
Sure.
it's not too deep.
No.
So you mentioned Impergum, right? Impergum is a polyether material.
Right.
You ever used it?
I have used it for a short period of time.
And it had some odor to it?
Correct.
Yeah. Okay. So when we made this, we neutralized the scent and the smell. It's no odor. It's a vinyl siloxane ether, so we incorporated PVS and polyether and blended the two together and really took the best of both worlds. So you get a slightly more rigid material, like you experience with, it essentially has the ability to extend into the vestibule without having to border mold, right? It can get up there and stay and hold its own during that muscle battle that it's facing with the cheeks. The medium body is hydrophilic, so you could take like a monojet syringe to your machine and backfill it and go true monophase in your impression, even subgingival. And the other thing I like to tell you about this is, whereas PVS, you hit the heat of the mouth and you're really on a time clock, right? It's starting to get tacky at about 30, 45 seconds or so. With this material, we give you extended chemical working time. So it hits the heat of the mouth, but this is setting up on chemical working time, not on heat of the mouth. Mm-hmm. So on one hand, I got to ask you to leave the impression in for, that kind of total set time, but we'll give you true working time, 1:20. Dr. D, 1:20. Imagine that, 80 seconds of pure chemical working time. So a lot of prosthodontists, implantologists, people who are tackling huge cases really love Identium because of that extended working time, when they don't have to rush it so much with the light body wash around components. And then, it's coming in a heavy, medium, light. Basically was designed to be your alternative option for polyether users out there. I'll tell you, when I meet a client that's using PVS and they're happy with PVS, they're fine to stay with PVS. It works. They get the job done many times over. People who use Impergum, they are interested in Identium. And many of them come on over and enjoy the differences that we've been able to figure out.
And
Okay.
the cost, I know Impergum has always been a premium product
Yeah.
and
Yeah.
cost a lot more than regular PVS. How does that cost compare for you guys?
Yeah, so that's going to be, as I mentioned earlier, when you compare like the cost savings 30 to 50%, that's going to be kind of closer to that 50 mark there on
Wow,
that one.
that's gonna
Yeah.
make a difference.
Yeah, yeah. And yeah, so it's worth a shot, right? At the end of the day, if you're open to exploring an alternative option where you're not going to sacrifice the quality and save a little bit of money, you got to have a look at it. So, all right. So Identium, we
So
touched on that.
you're right. So I want to, this kind of like, because it was a little confusing for me when I got
Yeah,
introduced
let's
to
let's
your
let's get
company.
into it.
I keep want to go back. So we had the bite registration material that are 3 or 4 different kinds. Whatever your flavor is, you can pick
Right.
that.
Sure.
Then you have the alginate replacement, which is medium body PVS called
True.
Silginate. Then you have the regular PVS that you have that
Yes.
is going to be comparable to premium products at a little bit lower cost, at a medium kind of price point.
Sure.
Uh,
Fair.
and then you have the polyether substitute that is a PVS and polyether combo. It's
Yes.
for those who want to look into a different option as far as controlling cost goes.
Gosh, I wish I could have said what you just said. I mean, we could have saved how many more minutes there? I
No,
mean, really, you just nailed it. You nailed it.
my job is to make things clear for myself, and I know dentists think like me, so they're like, "What are these names?" I'm like, "Here, there are 4 products. Okay,
Right.
don't get
Right.
too confused."
Thank you though for recapping that. Yeah, I could see how it's, people are lost already, but yeah, you nailed it. You nailed it. So we're almost finishing our silicone technology, and then I'm going to move into resins very shortly. Okay. So I got a couple accessory items that I want to throw at you.
Okay.
One's called the Mucopren Soft. All right. So let me ask you, Dr. D, when you get a edentulous patient in your chair who's been edentulous for many years, their ridge is stabilized, they're starting to resorb more though, and they're getting some hot spots. Do you reline chair side sometimes? Maybe use a soft for them?
I'm not a big reline chair side reline, but I do use it in certain instances.
Sure.
But yeah, I mean, I've always looked for a chair side reline that I could be happy with.
This might be it. So first off, it's a pink silicone, which is completely hydrophobic, right? We're
Mhm.
not hydrophilic anymore. We want to repel moisture, completely hydrophobic, and also resistant to candida and yeast. Okay, so there's the first thing. So very comfortable for your patient in that way. The key thing that about mucopren though is in the kit. It's going to come with the reline material, the patented mucopren adhesive, which sticks really well to acrylic. And then it's going to come with the mucopren sealant. And that's what really makes the difference. The final step after you've gotten all the flash off and you've buffed up the margin in between hard acrylic and soft reline is the silicone sealant. And think of it as like an extra light silicone. And you just take a paintbrush, paint it on, it dries. Ask the patient to wear the prosthesis for the rest of the day. Ask them not to soak this denture in alcohol any longer. And you got a soft reline that should last them for 2 years. So it's a resilient soft reliner. It's really kind of in a category by itself because I meet a lot of dentists who's like, yeah, I got a Linol kit, I got a, this kind of, I think we need to appreciate that there's tissue conditioners out there. And then there's a real soft reline kit, more for the long haul, versus, sending your patient's denture down the road to the lab for a reline. I mean, granted, hard relines all day, right? And some labs will buy the mucopren and put it on their menu option to let them do it. But you could do it chair side as well with this system.
Okay, great. So this was an important point that you brought on. I think because what I'm using is basically I use it after, um, when I'm doing overdentures for locator
Yeah,
dentures.
sure.
I use that around the implant, so that the denture doesn't rock basically on it. So this,
Okay. Stabilize it a bit. And this
yeah,
is
this stuff,
soon after surgery.
this stuff that I'm using doesn't last that long. So what you're explaining is a little
Yeah.
bit different. You're sealing it so it can become permanent.
Yeah, more of a resilient long-term solution, stabilized edentulous patient. They're going to love it. Especially for those who are listening right now. Betty, who's on the schedule often,
Mhm.
you know, nah, it doesn't feel good. I got the hot spot. Then it's not right.
Right, right.
Something new for that patient who just maybe needs something new in their life. The one thing I will tell you though is you do have to remove intaglio surface.
Right.
And you got to have that thickness in the denture to really nail it because you would like to see say 3-4 millimeters of thickness of this reline material to have some but you can play with it in different ways. So yeah, really cool product. And we sell the kit and then we sell just like basically, oh, I just need to buy the adhesive or I just need to buy the reline material. You could just buy these things individually as well.
Right.
All
And
right.
as you said, I keep coming back to this because I know the Impergum people are the hardest to change. I want to
Yeah.
say that you can spend $1,200 and they give you the new machine, the Automix thing, and you can
Yeah.
try their material. And
That's with us. You could,
it's,
you
yeah,
could,
it's low risk.
yeah.
You can do whatever you want. You can buy one of each, so that's great.
And to your point, like if the Muca print caught your attention, throw that into that deal to get that machine.
Exactly.
And that'll eat up a good chunk of it. So the next thing, if you don't mind me
Keep going.
weighing is airway metrics. Have you ever played with the sleep side of dentistry?
I have.
Okay. So obviously really important thing for dentists to dive into. It's complicated to say the least. There's a lot of different opinions out there. So let me give it a shot here with airway metrics. So Kettenbach acquired airway metrics. It was a free agent pickup, if you will, which I was really excited about, and I still am, to be in the game with sleep and to be respected of getting this really iconic design was we almost like feel like an ambassador to this product. So, are you familiar with the George gauge?
A little bit, yes.
Okay, so George gauge is most commonly used to capture a bite for a sleep appliance, and this is kind of an alternative to that. The airway metric system is a set of 16 unique keys, if you will. They're like little rectangles, and within the rectangle there's little divots, and that's where the maxillary and mandible incisors would go.
Mhm.
And these are all measured. So first we'll start vertical heights. Okay. So 4, 6, 8, 10, 12. We can open the vertical, okay, edge to edge. Now we can go protrusive with the mandible. And we're measuring this. Okay, you want to go 2 millimeters advanced? Let's go there, right? Let's lock it in. Okay, so you want to go 4, 5, 6, 7, edge to edge, right? So we can move the mandible forward, measured, and we can increase vertical. So what we find with dentists using this product is that they have this 3D bite that they can take upper and lower impressions, and then this bite, because essentially what happens is they find the sweet spot for the patient and they attach a bite fork to it, capture that bite record with this measurement in place that the patient and the dentist have agreed upon.
I see.
And then they can move forward with sending that bite and upper and lower impressions to the lab of choice that will make the appliance.
Yeah,
So I
it's
like to describe it as a little bit more work on the front end to try to avoid, hey, my TMJ is on fire. I'm not wearing this appliance tomorrow.
right, right. It's interesting because I wanted to kind of bring attention to it. A lot of people think about Kettenbach as an impression material company, but you have other products. You have a lot of different products that you can. This was one of them, right?
I mean, and more to come, my friend.
Mhm.
Um, you know, one thing I will say is for those out there who may, like yourself, you mentioned digital dentistry, and I get it. Trust me, I get it. It's the sexy thing. but we're a chemical company at the end of the day. So the owner said, we're not in the game of making things with plugs, essentially plugging into the wall, right? We're a chemical consumable company in many ways, with stuff that we use every day in dentistry. And I really hope people can see the value. Now, this airway metrics thing was a little bit, of course, it's not a chemistry, but it is a part of, taking a bite, for example. So it goes hand in hand with Futar and Panasil.
Mhm.
So a lot of sleep CE courses involve our product line and our support in that way. So I love it. My dad has sleep apnea, and he will not wear a CPAP machine. So I don't know. I'm just really excited for dentists to really, hopefully someday own this space. As masters of the start of the airway there. So we'll see where it goes, and we're excited about airway metrics.
Yeah, we have a
So
lot of members who are involved in sleep therapy, so this could be something attractive to them. That's great.
yeah, absolutely. So yeah, just a little kit that comes with those 16 different measurement components, and then the bite forks and handles that click into it, capture the bite. And oh
Jason,
yeah,
I'm gonna have to edit this out, but your picture just went kind of white.
yeah, I see that. I'm like froze here. Um, there
Here
we
we
go. Whoa,
go.
weird,
So
weird.
I'll edit this out. Go ahead and tell me, start that thought again, what you were saying.
Yeah. Okay, so yeah, we just had a little computer glitch there, no problem. Yeah, so airway metrics is just a great product to consider if you want to try to streamline your sleep dentistry practice. It helps you have it's like an interactive moment with the patient, Dr. D. It's like they get it, right? When you're like advancing their mandible little clicks at a time and then tilt them back and have them breathe and replicate snore noises, and it's like they're starting to get it, because all of a sudden it's harder to snore, and their airway feels more open, and they're like, oh wow, I'm breathing good, and again, it's a little bit of buy-in from them on the reality of what's to come. They're going to have their mandible advanced all night, so it's kind of helping them understand what's coming, and you can also listen and verify that airway is getting opened. Helps the lab nail it as well. So let me move away from all the stuff we've talked about and get into the resin side of it.
Mhm.
Yeah. So basically, Kettenbach's first thing, I must say, something that I don't hear any other dental companies talk about, but we decided with all of our resins, we're going to be 100% BPA free. BPA free. So I like to say this in my meetings. What's BPA do to plastic? Makes it soft, right? The kind of economy water bottle, right? We can just like crunch it, doesn't crack. So BPA, right? So you take BPA out of a resin, you take it out of a plastic, and it becomes harder. We feel that in those same water bottles. It's like a harder plastic, right? So think of it that way. We have hard resin materials. Our temp material, for example, I carry around a Gordon Christensen CR report, and they did a study on bisacryl temp material, and we're right at the top against all the brand names for being the strongest temp material on the market, right? So it's unbreakable in a way. I actually made like a guitar pick and have like this little bit of temp flash, and I hand it to docs and say, hey, take your fingernail into that. Imagine that being a margin. It's hard to chip, right?
Mhm.
So do you have problems with some of your temps from time to time breaking?
Yeah, was one of the reasons I went same day dentistry, because I didn't want to deal with temporaries anymore.
Sure. Sure.
It cost practices a lot of money. And
Okay.
when people talk to me about, oh, why did you go to milling? I'm like, I control things now a little
Yeah.
bit better.
Get to
But
skip the temp step. Yeah.
right,
But
but not everybody
yeah.
wants to get into that. And providing a temporary material that is durable can save a practice a lot of money, even
Yeah.
if they're paying a little bit more
Sure.
up front, people look at the upfront cost. They don't look at the fact that this patient in the week or 2 weeks that they're waiting for their crown has been in 3 times because they broke the temp.
Right.
That
Especially
costs the practice money.
the bruxers out there that seem
Yeah,
like probably everybody's bruxing these days with the stress of the world.
right.
Yeah, you know, you don't want broken temporaries on your schedule. Not a really profitable visit, and the patient's frustrated. So yeah, we got a really strong temp. I feel it's very aesthetic. I try to, definitely put this in front of doctors who call themselves aesthetic dentists. They focus on that side of the business. It's in the 10-to-1 style gun, which, Luxatemp from DMG is in, ProTemp, Integrity, these European style temp materials tend to be in that 10-to-1, the big and small.
Right, right.
So Dental Advisor gave us the 2023 top award winner for best universal provisional material. That's what the award we got for that. So I kind of think of it, universal, like, yeah, it could be the temp for your anterior case, no problem, or it could be your single unit posterior on a bruxer, no problem. It's a kind of all around good temp, good value. Shades A1, A2, A3, A3.5, B1, BL. Only thing I would ask you, Dentistry in general members, is remember to, if you're in you're using like a BL or a B1 in the anterior zone, and you got like a patient who smokes or drinks coffee or tea, or maybe eats food that has spices in it, these temporaries can stain. That's something I get a call from time to time. Jason, my BL is like, here's a picture, and it's all, so if you get a little temp glaze, and you put that temp glaze on your anterior temporary bridges, you'll find that you won't get any staining calls, because it'll seal that bisacryl real good.
Right,
So
right.
just a little nugget for those out there. So yeah, great material. Temp material is something I suggest you try. Another one where, I mean, people who order the quote unquote best of the best, I mean, that price point is up there on the temp material. So
Mhm.
we can save you a lot of money with that one.
So again, I want to stress the fact that you are not getting the cheapest, you're getting one of the best at a discounted price, which could be
Yeah.
still higher than your eBay shoppers or Net32 shoppers, but
Yeah.
we're not into that. I don't advocate that for dental material, basically.
Yeah. No, absolutely. I'm with you on that, all the way. The gray market materials, other countries have different regulations and things like this, and it's just, I think, to your point earlier, it's like, if the case goes wrong, it's just not
Yeah.
worth it at the end of the day. And I will say the same thing to like those shorter tips, and and mixing and matching different uh products and different brands and stuff. It's really, when you go off label, you're kind of going off and taking a risk. Sometimes it works out, sometimes it doesn't. I think at the end of the day, you just have to ask yourself, is it worth it?
Right. Right.
So I talked about the temp, got to give that a try. We have also a um, core buildup.
Mhm.
So the core buildup got 100% rating by Gordon Christensen's clinician's report. I don't look at those all the time, but I don't think they give out 100% too often. I think like 24 out of 24 of their CR evaluators gave it all 100%. So back to the BPA free thing. I think because it's lacking BPA, I get the feedback from dentists that when you trim the Visalys core, by the way, the product is, let me explain this. Visalys, Visalys, is the name of our kind of temp, core, and cement. It's like the family of resins. And then within the family of Visalys is Visalys temp, Visalys core, and Visalys Semcore, which I'll get into next. But the Visalys core, BPA free. So the feedback I get is it trims like natural dentin. So when you're in there telescopically prepping your core buildup, and then you get to your core and you just like divot, right? It's like soft and just
Right.
melt through it, right? Like, I didn't want to put a divot there, right? Yeah, I would imagine you may think that.
Mhm.
So when you transition from natural tooth to core with our product, it feels the same.
Okay.
The other thing is really easy to express out. This is a big problem in dentistry, like especially, people who are lacking forearm strength or thumb strength, maybe some arthritis. Some of these materials you have to refrigerate, and you're pushing cold resin through a small mixing tip, and you're getting in there shaking your hand, right? It's like our stuff comes out like the perfect consistency, the perfect pushback, the tactile feel is just right where it needs to be. I get that feedback a lot. The core that we designed has active connect technology, so it will work with your universal bonding agents on the market. The activator is built into the product, so really easy product to just slip right into the restorative system. Your assistants don't have to freak out about the etch and bond that you use. It'll work with it. And it comes in white and dentin in the 25 ml gun or the 5 ml syringe. Really good value.
These are light cure, dual cure. What kind of a curing?
Good question. So it's a dual cure product, which will totally self cure in 5 minutes. Okay. But if you want to hit it with the light, the general lights will cure 2 millimeter increments. So kind of one of those things, hit it with the light, take the light away, keep stacking, bring the light back. But I mean, in lunch and learns all the time. Sometimes I do this with like dental residents and, some of the younger folks. We have like competition, and I'll give them both core syringes and I'll say, who can stack it taller? Because our core material, you can build it up about 10, 12 millimeters before it starts kind of getting too wobbly. But, it's a very stackable, controllable material. And you may not even have to mess with the light, depending on the box you're trying to make or substructure you're trying to make or box you're trying to fill. So yeah, covered the, active connect. Yeah. So it's a great product though. The 5 ml syringes, is something that I think everybody out there should give a crack at. Okay. Almost done. This is the grand finale for you. Yeah. So cements. So I got my tie on. I just came from a lecture. I sponsored the Stark County Dental Society meeting down in Canton, Ohio. I live in Akron, Ohio, by the way. So here, prior to meeting with you, I was at a dental society meeting where Dr. Thomas Dudney was speaking out of Birmingham, Alabama. And he was addressing the crowd a lot about adhesive dentistry, right? Cementation. This is a big topic, lots of different categories. Let me ask you, Dr. D, what do you primarily cement with?
I have 2 cements. I use a GC product, and I use a Panavia product when I need more retention.
Good.
Those are the 2 that I use.
And I find this all the time, right? Your GC is the resin modified glass ionomer,
right?
When you got a great prep and it's just easy, right? And it just works. And then you got your Panavia for your more complex kind of bonding situations, right?
Right.
Okay. All right. So what we created in Semcor is in the bonding camp. It's an adhesive system. This system comes with 3 components. A resin syringe that is coming in 5 different shades, and then a tooth primer, which is going to self-etch your dentin surface, and then a restorative primer, which means anything that's not a tooth has to get the restorative primer wiped on. Underside of the crown, intaglio surface, metal abutment, or composite core. Anything that's not a tooth, we need to add that restorative primer to it because this is not a self-adhesive resin cement. We've separated the 2. But I got a key advantage for you. We incorporated silane and 10-MDP into the restorative primer. So, a lot of these systems out there, especially the self-adhesives, you got to, hey, grab me the Z prime, right? Oh, grab me the silane. Okay, we got to do the extra steps. With this, it's just literally both of these bonding agents are air thin. Apply it, let it air thin, dry. You know, and you don't have to light cure these bonding agents. Just let it a little air thinning, not too much, and then apply the Semcor to the tooth surface as a I gave away the big surprise. So Semcor, hence the name, it's a cement. It's also a core buildup. It's a 2-in-1 product.
So
So
I'm going to clarify here.
yeah,
So you did
yeah.
have a core buildup.
Yes, we have a regular core buildup that will accept regular, you know, universal bonding agents. Yes.
Universal bonding is it. And then you have a cement that can act as a core buildup as well.
Yes. So Kettenbach, you know, went to the FDA and said, here's this product. We want it to be a cement and a core buildup. And we are approved to be both. And if you think about this opportunity, I mean, you have the opportunity to literally reduce all of your cementation needs and core buildup needs to 3 components: a syringe, a restorative primer, and a tooth primer. So as I mentioned, you know, if you need to use it as a core, the tooth primer will etch and bond and this material stacks up. It's got the ability to stack, but then under compression, it gets a 12 micron film thickness layer.
Wow.
So it's acting as both. I say it's a cement first. It's a core buildup when you need it, or if you'd love to use this as a kind of a catch-all, absolutely, we'd love to have you. So
Yeah, there are times that you need this, you know, in the clinical setting.
sure,
Um, I keep reminding this case that I put on, and some people in the group um, were like, just put the cement in and push it in. Why did you? So I built it up, and then I have
yeah,
this trick that the patient doesn't want to get a new crown and want to wait for another few months. I put Vaseline inside of my
yeah, as a
crown.
matrix,
You run inside of the original crown and
yeah.
make a build up like a retrofit into the crown.
You did it for me again. I mean, that is so we have a starter pack that has the universal shade and then the 2 bonding agents. I can get that to your team of dentists in general for $99. And for $99 to add a true retrofit toolbox
Right.
where you can say, oh, assistant, you pulled the temp crown off and the core buildup came with it. I need to retrofit that core buildup because the crown's right here and I got to cement it today. Right. What you're talking about now is, this perfect crown that's in the box and all shiny. Now I got to use that as a matrix with Vaseline and everything. And
Right.
you can imagine, you know, these intaglio surfaces are all like very fragile. Like we don't want to put
Right.
Vaseline if we don't have to, you know, so you make it work, but no, literally you could retrofit the broken tooth, broken core, and cement at the same time. So low mechanical retentiveness, lack of ferrule, and retrofitting broken teeth. This is a great product to add to your toolkit for $99.
So in a case like that, you basically clean everything and then you put the tooth primer on the tooth.
You got to scrub that in for 20 seconds, you know, kind of create that little mechanical
Right.
retentiveness with the acid etch. But that's also got the bond in it. So you're ready to go on the tooth surface after that scrub.
So that's basically a one stop. And then you put the restoration primer inside of the crown, right?
That's right. It just wipe that on, a little air, and you're ready to go.
And then you put the cement. So in the case like this, how would you do this? You put the cement, a little bit of the buildup on the tooth, the same thing in the tooth, and then put it all together.
Yeah, and you know, in this scenario, you'd like to think you have some sort of orientation, you
Right.
know, something kind of, you know, contact, something kind of holding it there and getting that occlusion right. But yeah, that's what I'm saying. You know, kind of naturally retrofit this aspect of the tooth. And it's from my knowledge in the industry. I mean, Dr. Dudney actually today at this lecture was talking about just very unique in the ability to be both core or cement. And again, we'd love to have your support as your everyday cement, but you know, that uniqueness of being both, a lot of dentists are really excited about that. And the other thing I got to mention is it's color stable. So, I mean, if you become comfortable with this product, it's the resin's hydrophobic. So We're not having any issues with color staining around the margin if you're drinking coffee and wine and things like this. It is dual cure, right? So this is not a light cure only cement. You know, I know some of the aesthetic dentists want that for their veneering and so forth, but so you do have some working time to consider with this. Yeah, really versatile product, and we've gotten just unbelievable feedback. So we had our national sales meeting in Dallas, Texas, and we got to stop over at Clinical Mastery, and John Nasty addressed our team, and he experienced this cement. He called it the gorilla glue of dentistry. And I love that, right? Because of, you know, if you think about this, the same material as the core, as the cement, you got this monoblock chunk of the same resin and you know, these two primers. It's just less layers of chemistry. And you know, it creates this really, you know, monoblock connection to the tooth, to the crown. So the, you know, hence the name Gorilla Glue. We got really high marks for shear bond strength in this product.
Jason, I'm sure a lot of people have this question. How about different material? I know people use gold crowns, PFMs, now
Yeah.
zirconia, then the silicate and disilicate stuff.
No,
Is this
literally everything.
everything?
So in the catalog, it'll say precious metal, oxide ceramic, silicate ceramic, hybrid ceramic, and composites. And then it's for the types of restorations: veneers, inlays, onlays, partial crowns, crowns, bridges, Maryland bridges, root posts, indirect core buildups. So it can do all these things on all these substrates. I mean, like I said, Kettenbach is a chemical consumable company that has superpowers in each one of its products.
Wow.
And this Semcor product is a product that I think everybody's got to have. Even if you're not going to use it as your everyday cement, you got to have it though. Because I know you face these situations, whether it's low mechanical retention, lack of ferrule, retrofitting opportunities. But if you get comfortable with this, you might find you want to use it more and more and more. Really cool product. And again, the starter pack comes with the 2 bonding agents and the universal shade A2, A3, and then the mixing tips, as well as those little intraoral tips to use this as like an endo canal root post cementation kit. It could be that as well, you know. So very versatile.
And price wise, again, pretty
Yeah.
competitive with the high quality at a discount.
Yeah. So the reason that we're able to work with, you know, silicate ceramics like Emax and zirconium so well is because, again, the restorative primer has MDP and silane built into it. So you get to skip those steps as you apply that to the intaglio. And we sell our bonding agents very, very favorable. This is I was shocked to understand how much bonding agents cost.
Right.
Wow. Liquid gold.
Yep. Exactly.
So let's just say we're liquid copper in terms of the price points on that. You know, it's much less. And then the resin syringe, they're all sold in individually. We have try-in pastes, of course, with this. All the resin syringes and their shades. So it's going to be the shades of translucent, opaque, universal, dark, and bleach. The restorative primer, tooth primer, and then the 5 shades.
Great. So let me kind of recap. We had our impression material segment that was bite material, PVS polyether combo, and Silginate, which is the alginate replacement.
True. Yep.
Then we had
the ancillary items. Remember the soft and the airway?
Right. And we have this product that you guys have for measuring basically the jaw movements, correct? For
the vertical and horizontal position of where your airway appliance, sleep appliance will be at the end. Correct. And then the mucopren soft reline for edentulalism.
Right. That we had exactly. And then the resin stuff, that is 3 categories of cement, build-up, and temporary, basically.
Yeah, we have a cement and core buildup, 2-in-1 product. a regular core buildup that works with any bonding agent out there, universal bond, and then a real high quality universal temporary material in the 10-to-1 style gun. Yep, you got it. So again, when I introduce myself, I'm like, hey, I'm Jason from Kettenbach, German manufacturer of restorative materials. We focus on the silicone and resin side of the business in your restorative workflow. And we only sell direct for less. So basically, for those out there interested in working with us, let me just say we got a great website. I know a lot of people like to go to the web. We hired a social media manager. So as we, dentistry in general, he would love to hear me say, like us on Facebook, Instagram, make sure you follow us. We're trying to get our membership up in that way. As you know, this world very well. But it's kind of the best way to stay in touch with, that kind of what's new, it's going to come at you quickly. But no, our website, we have two different websites, actually, Dr. D. One website's dedicated to just products, right? So just technical information. You got information on each product. You got instructions for use, MSDS sheets, really not like a salesy website, more so like I want to learn. I want to dive into the weeds like we've been doing today. But then we have a separate website that is for the web shop. And we're noticing a lot of people like to order through the web, and we've developed that web shop very nicely. So let me give you those. So if you want the product information, go to www.kettenbach-dental.us. Okay. And then if you want to go to the web shop just to kind of get in there and see what we got, go to just www.kettenbachusa.com. And then finally, if you're interested in just, giving a call to the office, that number is 877-532-2123. And that will be our Kettenbach customer service line. They'll be able to help you out and get you potentially in touch with your outside field rep, like myself. Now, keep this in mind, though, people out there in this world, we are direct reps. I cover a big geographic land, and we do our best to get around. And trust me, we're eager to meet with you and explain our value and go into details. But give us a little grace. We're covering a lot of ground, and we're trying to get everywhere and help everybody as much as we can. So, but I think that's a good way to go. Whether you email or call in, hey, I'm interested to learn more. Send somebody my way. That would be great. We would love to get an email like that as a rep. Hey, Dr. D from Aurora, Illinois wants you to stop by. I'd love that.
Yeah, and all of this information will be in the caption of this video.
Thank you.
People can access. We do have, I think we do have a landing page actually for our members that was created by your company. So I will put all of that in the caption.
Okay.
And people can access you guys. Hey, I really wanted to thank you today for explaining all this, because I want people to know quality products, and Kettenbach is quality product and quality company, and we appreciate the support of the platform. You guys are a sponsor of the group, and hopefully we can, when you have new products or things like that, we can do this again and come and introduce it for us.
We actually do have some new products coming. Let me hold back on the details there, but the first one that came out this year was Futar Easy,
right?
And Futar Easy Fast, which has got that mousse-like consistency. But there's likely going to be 3 other products coming this year from Kettenbach, which I know our fans out there are going to be really excited about. And let me recap too. $99 for pick 3 of the different things, right? And then I didn't mention, so we got the $99 deal on kind of the silicone stuff, and then we have a $299 deal for our resins, and that's where it's going to get you a box of temp, a box of regular core, and then a box of that SEM core, the starter pack that comes with the bonding agents. You're going to get all 3 of our resins for $299, and I challenge you to try to adopt that into your system, just to see if maybe we could bring something to the table for your practice and your patients. Right. Dr. D, I can't thank you enough for just this long form conversation. I hope I hope I didn't come off too like sales pitchy or whatever. I'm just a big fan. You know, I love restorative dentistry, grew up in the lab, care a lot about it. And I want, you know, the dentist to love their results. I get the thing that just builds me up is when really respected dentists, you know, that I come in touch with, and anybody, right? Like when they tell me how much they love our product and we got the best stuff out there. I mean, I hear that a lot,
Yep.
you know, and it just keeps me going. And um, I hope that, you know, we can bring something to the table out there for the people listening to this today. And I just can't thank you enough to bring us to the table so we can get that brand awareness out there. Cause you're right. You're right. I hear that a lot too, where it's like, I never heard of you before. Like,
Right.
you know, because you get so, you know, all these bigger companies got the marketing budget and the magazines and, you know, the big brand names, but we are a total up and comer. And, you know, we're here, we're on the map, we're playing ball with the big boys right now. And I hope you guys, as you travel through your CE and you go to the bigger meetings, you come by and you see us and you see that we're involved in sponsoring, continuing education in dentistry and really being on the right side of things here as we go forward in dentistry, like you had talked about earlier.
Great. Thank you very much. And hopefully we can continue this at another time.
Let's do it. Let's catch up in a couple months, a few months from
Okay.
now, and get you some updates. And I can't thank you enough, Dr. D. It's been a pleasure.
Of course. Thank you.
All right. Have a good night.